Okay. Good morning, everyone, and hope everyone is well and enjoying the lovely sunshine wherever we are this morning. My name is Aisling Duffy. I'm a Senior Project Manager with HSE Mental Health Operations. So I've been working alongside our colleagues here today in older persons operations within the HSE as well, and to organise these webinars, and also our colleagues in the Irish Hospice Foundation and Healthy Ireland within the HSE. So thanks to those joining us today. So I'm just going to give a small background, a short background on how we got here. So I suppose it's about 7 months in the making, and my own office received funding to support nursing homes with a psychosocial focus. So one of the main things that came up really was a need for the acknowledgement and support around grief as a result of COVID-19. So mental health operations and the COVID response team within older persons, and Roisin will actually speak a little bit more about this, joined together just to kind of scope out what that would look like. We then got Breffney in the Irish Hospice Foundation on board, and I suppose Breffney has really supported us with developing the content for today, and he will deliver that in a short while. And I suppose the real focus is on supporting people working in nursing homes who have been affected by grief due to COVID-19. And I suppose we look at wider psychosocial supports as well. And Sarah McCormack, who is a Healthy Ireland lead, will speak after Breffney this morning, and will speak about how we can support ourselves and also other supports and services that are available to us as staff. I'm conscious that we have some non-HSE staff with us today, and you're very welcome. And just to say that there may be a small number of supports that we mentioned this morning that are only available to HSE staff. However, we'd advise you to go back to your own employer to seek similar supports if that is something that you would like or require. So yeah, just to say you're very welcome. Everyone is very welcome here this morning. We're delighted to be able to run something like this, and really hope that you find benefit in it. So I'll just actually go through a couple of the small housekeeping bits for the day. So the morning will run from 11, so just after 11 now, until about 12:30. So we're conscious that people will go back to their workplaces after that. So we get finished up before 12:30. And just to say that if you'd like to ask a question or make a comment throughout the morning, please use the chat function, and I'll be keeping an eye on those, and I can feed that to the speakers then, and to answer or comment on any of your queries. And as I mentioned there, that if there are some of the resources and that you'd like to find out more about, we will be in contact with you afterwards. I'll put together an email with different resources and possibly some of the presentations as well, and I'll send that out to you afterwards. And just to say that the webinar is being recorded, again, I'll send a link to you afterwards, and if you'd like to share it with any of your colleagues who couldn't make it this morning, I will share the link with you afterwards. So I am now going to hand you over to Roisin McGuire. Roisin is a General Manager in the Older Persons Operations Office within the HSE. So thank you very much, Roisin.
Thanks, Ashley. Good morning, everybody, and you're all very welcome to the webinar. So just to follow on from what Ashley has said there, I've been involved, as has my colleague on the webinar here, Jackie McCormack, with the National CRT Forum, the COVID Response Teams Forum, since the very beginning of COVID-19 and the response that was required from us in the health services, within older persons and particularly in the nursing homes. And as a result of that work, there was a request from the forum to look at and give some information and materials to people on the dealing with the impact of COVID-19 and the grief that was involved in that for everybody. So that's what this morning's webinar is about. In moving forward, I want to, first of all, I want to welcome everybody, and I want to thank everybody. As I say, we've been involved with the response and with the teams, the team leads of the response, as you've been involved in being the response out there since the very beginning. So I want to acknowledge all of the work that you've done over the 2 years. We've moved on from, I suppose, the real crisis and emergency crisis that was there in the beginning now, but that is what it was. was a pandemic, it was unknown to us, there was an emergency, and a lot of people on the call this morning, you were the managers who were in the front line, you were dealing with an unknown circumstance, and you did it with great professionalism, as you always do. So it's really important that we acknowledge that to you, and we've done it through the forum all the way along. But some of you we wouldn't have met before, you would have met your CRT leads, but we wouldn't have met you. So it's good to meet you this morning and to thank you for all of that. So again, this is a request from yourselves that came through to us. So we're very, very happy to respond to it, and we invite you now to take time out of the day for yourselves. This morning's webinar is for managers, both within the HSE, and I know people are joining us from the private nursing homes, and we plan to have another one for staff. And as Sarah said, or Aisling said, this will be recorded. So please just, I suppose, take time and come into the room with us now to engage in what we're here to do. Give yourself space, and I do hope that you find it constructive and helpful. We will follow up on anything that you raised today in the chat box or otherwise, and we will respond to that in whatever is the appropriate way. So we're quite happy to take any other requests from you. So thanks again, and I now hand over to Bethany. Bethany is from the Irish Hospice Foundation. Yeah, I was just going to
perfect. Thanks, that's perfect. And to look, we'll let Bethany introduce himself and his role as well.
Great, thanks very much, Aisling and Roisin, and good morning, everyone. You're very welcome, and it's a pleasure to be with you here today, looking at, I suppose, the impact of grief on you as managers, on your nursing home, on your staff, in what, as Roisin has described, has been an unprecedented pandemic, which we are still navigating, but it's a very different place we're in now to where we were over the last 2 years. I suppose what this morning is about, as I understand it, is to take a little moment and just to catch our breath and reflect a little bit just on some of the experiences that people have had during those 2 years, particularly around the pandemic and the different experiences that each of you would have had in your nursing homes, which could have been quite challenging at times. I'd like to echo as well what Roisin said, again, just to acknowledge the tremendous work that people have done in very, very difficult circumstances. And I think that's a starting point, and the gratitude that I and many other members of the public owe to you for the work that you did in very challenging circumstances. So what I'm going to do this morning is have a look a little bit at how and what we know around workplaces and grief. My role is in the Bereavement Department of the Irish Hospice Foundation. My work involves development work, particularly with workplaces, on the impact of loss and grief on staff and how we can support staff who experience bereavement, whether that arises as part of their work or whether it arises in their personal lives. So that's a large part of the work that I do. And I've been with the Irish Hospice Foundation for almost 20 years now, in various roles, and my current role is, as I say, in relation to the Grief in the Workplace programme, which I lead out on. My background is in psychotherapy, but don't worry, I'm not going to be psychoanalyzing you, but that's some of my background, and also pastoral care, so that's how I've come to be where I am with this and doing this kind of work. And as I say, it's a real pleasure to be working with you this morning. I hope this will be a helpful and useful session for you. And maybe what we might do, just to start with, and I'm going to encourage you just to let you know that in a recording, as far as I know, none of the chat gets shown in the recording, so this won't be shown on the recording so far as I know. But I'm going to invite you to maybe just have a think about, is there one thing that you would like to get from this session today? What I'm going to be covering is a little bit on the grieving process, what we know about how grief impacts on staff, particularly in the nursing home context, and what are some of the things that we can do to support ourselves, our colleagues, or staff who are reporting to us. So they're the main areas that I'm going to be covering. Within that context, is there one thing which you would like to leave with from today's session, a takeaway for you from the session? And I'm going to encourage you, if you wouldn't mind, use the chat function, and Aisling will be monitoring that, and we keep an eye on that. So maybe just take a moment and pop in what for you would be something that you would like to get from this session today. Just take a moment and use the chat function if you can, and that gives a bit of an idea of what might be helpful. Okay, and just to confirm that Aisling has said to me that no chat function will be shared on the recording, so anything you put into the chat will not be shared on the recording. Okay. That's lovely. So I am going to begin by sharing some slides. And hopefully you're able to see that there now. Of course, if I went to the home button, that would be a good start. So what we're going to look at today. So I'm going to look at a couple of different areas. Firstly, just a brief look back at COVID-19 and the grieving process. What there are two types of grief, I suppose, that we think about when we think about the nursing home context, and that would be personal and professional grief. So I'm going to have a look at that. And what can help when we are grieving? What is the role of the manager in grieving? And I see that somebody has asked about, look, what kind of supports are there? How can I support staff? And that's something we're going to have a look at. And then self-care. How do I look after myself when I am grieving? And those points about minding myself and making sure that I'm okay as well. So I'm going to begin by looking at COVID-19, and you all have been steeped in this at the front end of the COVID-19 response. I'm showing a picture here of a church in Ballally in Dublin, and in that church, when the first person died in Ireland from COVID-19, they made a small St. Bridget's cross and they put it on the outside of the door of the church. And as the pandemic progressed, they made crosses and put them on the outside of the building for each person who died in Ireland from COVID-19. And you can see, I know it's a little bit blurry on the photograph, but what you can see there is the whole outside of not just the door and not just the church building, but also their community centre and a little sacred space that they have as well, is now covered with crosses from people who have died in COVID-19. Why I like this photograph is it gives us a sense of the enormity of what it is that we have been living through and living with. And sometimes it's good to just stop and remember that COVID-19 has affected a huge amount of people. It's affected all of us in some way, but for some people it's particularly affected them. If somebody had a loved one who died from COVID-19, that's what we're seeing represented on these walls of the church. But also for anybody else who was bereaved during that time, during the last 2 years, the normal rituals and normal procedures that we had for grieving were really turned upside down, and that made it very difficult for people as well. Another reason why I like this photograph, that young man you can see at the front of the picture with the bicycle, he stops there and he stops regularly at this place in Dundrum. He's a Spanish national, and his grandfather died in the first wave of COVID. He was working here in Ireland. He couldn't get back to Spain, and so he comes to this place to remember his grandfather. And I suppose it reminds us of just how worldwide COVID has been, and that the impact of COVID stretches across nations and across peoples. So I suppose taking time to just reflect and remember that this has been an enormous challenge to all of us and an enormous change to our lives. there have been challenges and also opportunities with COVID. Some of the challenges, particularly from a grief point of view, and this would be relevant for you among your staff and also the families that you support. One of the things that we know has been most challenging in the literature is the way that loved ones have died. So if people haven't been able to see or be with their loved one at the time of their death, that can make the grieving more challenging. Even where people have been present, often they were wearing PPE. And that in itself, while it was great to be able to be there and be with the person, and it's better than not being able to be there, but you also had the complications that we had these barriers between ourselves and the person that we're trying to support as they die. Some people had to grieve alone, and that can be very challenging for people. And also there is what we would call delayed grief. And that's where, again, for many of us, we've just been getting through the last 2 years and keeping our heads down. And a bit like Roisin was saying, there were many, many challenges, and they kept coming, and they kept coming at you, and different guidance and different things you had to do. And there's a lot of fear and a lot of concern out there. And sometimes when we're in those kind of situations, we do what we need to do. And for anybody who has been bereaved, sometimes we might just put that a little bit on hold because we have to get through what we have to get through. So that's something, again, that might be there for you, for your staff, for the families in your nursing home. Interestingly, there's also been opportunities, which might sound strange to talk about COVID as an opportunity, particularly around grieving. What it has given us, ironically, is more openness to how death and grief affects people. Death has become front and centre because of COVID, not just in Ireland, but right across the world. And how we respond to death and how we think about death, how we think about grief, particularly for staff and how it can impact on us. I think there's much greater openness to that now. Interestingly, some of the studies coming out of China, Italy, and Greece around the impact on healthcare staff of the COVID-19 pandemic have thrown up some very interesting results. Some we would expect that some people have been traumatized and some people have found it very difficult. But what has been surprising is that many people have found a new sense of value in their work, of being valued, and the sense of being part of something, even though it has been very demanding and very difficult, but being part of something worthwhile in terms of trying to provide care to people in very difficult circumstances. There's one study from China which covered, I think, around 48,000 nurses who were involved in frontline work with the first wave of COVID. And what they found that the level of post-traumatic stress was similar to SARS and what was expected. What wasn't expected was what they call a large increase in compassion satisfaction, where nurses were reporting that they found a satisfaction in being able to help and being able to do their work in a worldwide pandemic. There can be a greater sense of community. I'm not sure what your own experience of that has been. We certainly found it in the Irish Hospice Foundation. Barriers which had been there just fell away. Greater collaborations, evidenced by what we're doing here today, working with the HSC. We set up a bereavement support line with the HSC, so there were a great sense of professional community, but also personal community. I know I live in Clontarf from Dublin, and I got to know my neighbours much more than I would have ever before, and that was lovely, and that has persisted as well. In terms of once we've moved out of COVID, so it's brought challenges, it's brought opportunities as well. It's good to be aware that even though we're coming out of it now, and rightfully so, we're rightfully kind of enjoying things that we couldn't enjoy. I mean, if you think about it, it's ironic that this year we're having trouble at airports because everybody wants to get away. We couldn't do that last year or the year before. So it's great that we can do that. From a grief point of view, we have to be mindful, though, of what has happened. We have to be careful not to move too quickly away from that reality. And give our staff and give our families and loved ones the chance also to process some of what has people have dealt with and indeed are still dealing with and will be dealing with on an ongoing basis. So just in terms of looking at loss and grief, what are we talking about? I mean, particularly in terms of the deaths, there have been a huge number of deaths from COVID. And how does that impact on people? Again, one of the things I said there that's going to be really significant for nursing homes is the way that people died. And we know that that happened in difficult circumstances. It wasn't always perfect, and in fact, at times, it was less than ideal. And that's part of what people carry. And so when we look at that kind of grief, and we're thinking about how do I support my staff, how do I support my families or other people linked with my nursing home, one of the good ways to start with this is to have a think about, well, okay, what is the key to understanding grief, whether that's my own grief, staff grief, family grief. And that is, it's understanding the significance of the loss for the person and how they experience that loss. And I suppose when we're looking at how to support somebody, that is one of the keys that we would use. What is the significance of this loss for this person, for this family, for this loved one? What's the significance for the staff member? And how can I support them in that? We know that grief is a slow and a gradual process. It's a natural process. It's a normal process. It's not a sickness or an illness. And if a staff member is grieving, that is not a sign of weakness. That's a sign of humanity. So how can we support people to grieve well and healthily around what has happened? I'm going to show you a short video, and this is a video on the grieving process. And what I'd like you to do is just have a look at the video and just have a think, look, what stands out for me? There might be a phrase, there might be a concept or something in there that stands out for you. Just have a look at it and see what stays with you after you look at this video. And this is around the grieving process and having a look at how we might understand that.
Loss is losing something that is of significance. Most of us, our greatest loss will be the death of a loved one, and we will mourn that loss most of all. Donal lost his mother recently. As she was dying, he was able to be with her, hold her hand, and say goodbye. He told her that she'd been an amazing mom, and had touched many people's lives. Grief is like a roller coaster. It turns your world upside down. It affects all aspects of your life and involves mental, physical, emotional, and spiritual suffering resulting from loss. It is not an illness or something to be fixed, but rather a natural process of reaction and adjustment to loss and change. This adjustment involves moving back and forth between loss coping, focusing on who we have lost, and restoration coping, adjusting to life without them. It is normal to experience a range of feelings when we are grieving. Some, like sadness and loneliness, might be
Just bear with me.
Might be expected, but others, like anger, rage, and guilt, may be more difficult to accept. The aim of our grieving is to help us adjust to changes in our lives. It is not to forget about who or what we have lost, but to learn to live with those losses in our lives. It's natural to have an uneven journey with grief. Grief comes and goes like waves. There are going to be peaks and troughs, and they don't always happen in predictable ways. Some months after his mum's death, Donal hears the song his mum loved and is overcome with a wave of grief. He hangs in there and gradually the pain subsides. Remember that during loss coping, we need to be able to focus on loss and whatever feelings we experience around it, including sadness, guilt, anger, etc. But we also need to spend time on restoration coping, adjusting to life without the person who has died. Where people run into difficulties or where grief gets complicated or is stuck is when the process of moving between these two types of coping breaks down. People can get stuck on either loss coping or restoration coping. If someone gets stuck on loss coping, all they can do is think about the loss and the person who has died. They can find it difficult to get on with other things they need to do in their life. But equally difficult is where people get stuck on restoration coping and think, this has happened, I have to cut that person out of my life and forget about them, sell the house, clear out all the clothes, get rid of everything. Good bereavement care involves enabling the movement between loss coping and restoration coping. People need to do both to grieve well.
So I'm going to invite you again to use the chat function, and then I'm going to stop the presentation and just ask Aisling maybe to read through some of your inputs in terms of the chat function. But maybe just to pop into the chat function, what struck you about that video? There's something that stood out for you about that video, and which was looking at explaining the grieving process. And I just invite you to pop that into the chat function. And then we'll just take a moment. I'm going to invite Aisling maybe to do two things. One, to have a look through some of the things that you want to get from today. We'll just chat a bit about that. And also then to look at your reactions to that video. And what I'm really looking at here is what stands out for you? What strikes you? Does that make sense to you in terms of a grieving process? We're looking there at loss coping, being able to focus on the loss, and also restoration coping, being able to focus on how do I adjust to my life now that this person has died. And that bit, that the grieving process involves moving backwards and forwards between these two things. And that's also the way it is in the workplace. So we need in our workplaces to be able to focus also on what has happened, on the losses, and be in touch with our experiences there. And also to adjust now that those things have happened, and make the changes based on that. It's not one or the other, it's both. So I'm going to invite you, please, to pop into the chat function. Just whatever struck you about that that video there. And
Hi, Bethany. Yeah. So I suppose just some of the pieces people are hoping to get out of today. So to learn more about how to control the fear of a new wave of COVID, fear of not having staff to look after the residents due to staff illness, and what supports I can offer, providing support to my colleagues as they have lost residents that essentially were part of their families and have known for a long time.
Yeah.
And then just another comment from someone is just around the supports and being available when you're on call 24/7 and how we can access these supports.
Mm-hmm.
So those, and do you want me to read out the new comments in around the grieving process?
I will in just a moment, Aisling, just to comment on both of those. So again, thank you very much for sharing those comments and being so honest about them. And I think it's very good to articulate that fear if there is a new wave. And again, just the demands and being available 24/7, like that's a lot of pressure. And I suppose it's important to be aware and to try and get supports around that that are helpful for you. But there's a lot, obviously, that has been done, but that fear of a new wave and how will I be able to manage, and what supports are there for me? It's slightly outside of the grief piece of this, but they're very important concerns to recognise. So thank you for sharing those. Yes, Aisling, great. And if we can have a look then at maybe some of the comments in relation to the video itself there.
Yeah, absolutely. So one of the comments is the importance of balancing loss, coping with restoration, and how you can get stuck in both of those.
Yes. Yeah, and we need to be able to do both, and it's not one or the other. We move backwards and forwards between the two. Yeah. Mm-hmm.
And then just a comment, the grieving process go on for a very long time, and it can be triggered by memories, smells, for example. You can forget the person that is gone or what has happened over the last few years. We don't just fix ourselves overnight, and this is something the HSC needs to recognise. And sorry, I just you can't forget the person that is gone. Apologies, I misread that there.
Okay, yeah, that's a really good point, and there's a couple of good things in that. Yes, this is not a quick fix process; it's slow, and we can't forget the people who have died. And one of the other comments that was there about how staff have lost residents who they knew for a very long time, and who another way somebody said it was part of their family. That's absolutely true, and we need to honour the grief of staff. We need to honour what people are experiencing, and it doesn't go overnight. And you can't just kind of forget about it. That's not what grieving is about. Grieving is about learning to live with the losses. And that means being able, as that video showed, being able to dip into the loss coping and dip into the restoration coping, in and out and in and out. The other thing that I might just mention there, Aisling, is in terms of what we would call grief bursts. And a grief burst is where somebody, I think, described it where someone there was saying that, it can be triggered by a smell or something like that. And it's almost like you're back in the place where when the person died, you're right back in that moment. We call those bursts of grief, and anything can trigger it. It can be a smell, it can be a sound, it can be a record, it can be something somebody says. I know when my mum died, she died of dementia a good while ago. But I remember soon afterwards, one of my relatives, I just met them and they were saying, "Oh, this is a rose bush that your mum had given me." And I don't know what, it just hit me, and I was in floods of tears. It was like, this was a good while after my mum died, but it just took me back there and connected me with it. That is entirely normal. That's normal grieving. And those times when we get the bursts of grief, they're normal. Staff will experience those, families will experience those. And the kind of supportive response there is simply to allow that grief burst, to support the person when they have it, not try to fix it or not try to rush in too quickly, but just to support the person. And what you'll generally find is people will self-regulate out of a grief burst. They'll come back out of it themselves if they are supported. And that support simply might be sitting down, if it's a staff member, giving them a cup of tea, just taking them to a quiet place and just being with them and allowing them to express their grief and to know that that is normal, that there's nothing wrong with it, and that's a healthy part of grieving. Thanks very much, Aisling, for that. That's brilliant.
There's a couple of more comments there, briefly.
Yeah,
I'll just read them out. And someone just commented that this video really accurately describes what I've been feeling over the past year since my mother passed. Thank you. And thank you for sharing that with us.
Yeah, thank you. Yeah, no problem at all.
And the final one there is just around how to cope with the grieving process, not being so angry all the time over a loss. I think that's just in relation to the video there.
Yeah. And I suppose the other thing is to recognise that anger is a normal part of our grieving. And that can be hard sometimes because anger and other strong emotions as well can be a normal part of our grieving. Again, just in relation to my mum had dementia. And I remember this would be about 2 years after her death. My mum died when she was 79. And I was out walking and I met a neighbour, and the neighbour is 83, 84. And I met her and we were just chatting. But she told me she had just turned 84. And the woman was as clear as a bell in her mind. And I got this stab of jealousy that my man didn't get to 84, with the clear mind. And it's like, it's totally irrational stuff. But that's what grieving is. They're very strong emotions, which we maybe wouldn't normally associate with ourselves. But that's a normal part of grieving. And it's funny, it kind of hit me in a funny way. And I thought, oh my God, why am I feeling that? It's 2 years after my mum died. But I think what I was feeling was the unfairness of my mum not getting 84 years and somebody else did. But that's grief. And that's what can come up. That can come up with families, that can come up with staff. And again, our role is to be supportive and not to close down those kind of feelings, but allowing them and allowing that they're normal. And that people will cope with them. Grieving isn't about not having the emotions, it's about allowing them and learning to live with them and learning to live with the loss. And it's a slow process, as one of your people commented. It doesn't happen overnight or in a couple of weeks or in a couple of months. It actually takes quite a bit of time. Thanks very much, Aisling. That's brilliant. I'm going to hop on here and we come back to some more comments. Oh, we've done that. Right. Just something else to have a look at. Again, quick question. You don't have to put that into the chat box, but just listen to your own reaction. Do men and women grieve the same way? So just think about what your gut reaction to that is. And there's not right or wrong answer, just gut reaction to it. Do men and women grieve the same way? Because this is important, I suppose, in terms of, again, for your staff, for families that you might be supporting, or indeed in your own personal life. Generally, what we would say is that rather than thinking about grieving being gender-based, that we talk about different grieving styles. And there are two main styles of grieving that we talk about. The first one would be what we call an intuitive grieving style. And that's generally associated with the feminine or with the female. And an intuitive grieving style is a style where I process my grief by openly talking about my feelings with others, essentially. That's a shorthand version. And I have a need and a desire to do that. That's the way that I process my grief, generally associated with the feminine. And again, that's a bit where I gather people around, or I talk about it, express my feelings openly, maybe I cry, or I do other things. Interestingly, the other end of the spectrum is what we call an instrumental style of grieving. And an instrumental style of grieving is equally as valid. I still feel the same pain of loss, but I process it differently. And I process my grief through problem solving, through activity or work. And interestingly, I don't seek out others with whom to share my grief openly. And this is generally associated with the masculine or with men. And that instrumental style of grieving, the shorthand is instrumental grievers process their grief through doing. Intuitive grievers process their grief through feelings and openly expressing them. And it's a bit like you've got two ends of a spectrum, instrumental on one end, intuitive on the other. And most of us are a bit of a blend of the two, but generally we will have one style that is dominant. So what is really interesting is you can have men who are intuitive grievers. That is, men who process their grief through a need and desire to openly express their feelings. And the really interesting bit is you can have women who are instrumental grievers. That is, women who process their grief not by gathering others around, but by problem solving, activity, and work. The big point here and the big takeaway for you with your staff, with families, with anybody that you're supporting, even with yourself, is that there are different styles of grieving. One style is not necessarily better than the other. And what can be really helpful if you're in the supportive role is to think, well, look, talk to the person. It's always a good way to go. Just ask them, look, how do you normally cope with things? And how can I support you best? And listen to what the person comes back with. Some people may say, look, thanks for asking. I like to work it out myself. Somebody else may say, thanks for asking. I just really want to talk about my mum and what happened. And you get a bit of an idea there. For yourself, I suppose the takeaway is to be open that there are different ways of doing this. There are different ways of grieving. What's my own style? Personally, I'm kind of more on the intuitive style, but I have an instrumental piece in there as well. But knowing what my style is and knowing that my style might be different to somebody else's style, and just being open that there are different ways of coming at this grieving process. As a manager, what you can do is support whatever grieving style a person has, and that may be different for different staff. So again, for example, if you experience deaths during COVID in your nursing home, staff may react to that same death differently. Some people may be quite affected, some people may want to talk about it, others may not. So that can be helpful to know that there are different ways of doing this, and that there isn't one right way. Okay, just another piece that can be helpful around the goals of grieving and what's the purpose, what are we trying to do? I love this image of the jars as presenting two kind of approaches to this. The first approach is what we call shrinking our grief, and the second approach is called growing our world. I'll just take the first one, shrinking our grief, that's the top set of jars. And this is like, what's the aim of grieving? What are we trying to do? And if you think of the jar as being you, the person, and the black ball is the grief. So if we look at the top set of jars, the one on the left is maybe at the time when the death occurs. And it's like the ball of grief fills our jar, and we're full with grief. And with the shrinking grief approach, the idea was, well, look, as time goes on, let's say the second jar is a year after the death, and you can see the black ball of grief has got smaller. And then the third jar, the one on the right, on the top, let's say that's 2 years after the death, you can see the black ball's getting even smaller. And the idea kind of was, well, look, as time goes on, it gets so small you hardly even notice it. But a lot of people found that didn't match with their experience of grief. And so a more helpful way of thinking about the purpose of grieving is the idea of the bottom set of jars, which is growing your world. And again, you can see that the jar on the left is The first one is the person, the jar is the person, the black ball fills the jar. And let's say after a year, what happens? The actual black ball of grief stays the same size, but look at what is changing. The person, your life begins to expand around the grief. And then if we look at the third jar, the one on the right on the bottom, again, let's say that's 2 years after the death, again, you can see that the black ball is the same size, but the jar is getting bigger. And that's a helpful way of thinking about grief and the purpose and the goals of our grieving and adjusting well. In your nursing homes where you have had deaths because of COVID, that grief is still there with you. And it's not about shrinking it or getting rid of it. It's about growing your world, growing as a manager, as a staff group, as a nursing home, with the families, growing around that reality. And not forgetting about the people who have died, not forgetting about your own grief, bringing that with you, but expanding your world around it. And I think it's a nice way of thinking about grief and grieving and what we're aiming at. And it's more that idea of learning to live with the losses in our lives rather than trying to get over them or forget about them. So I want to say a little bit about that's grief in general. What about the personal and professional aspects of grief? So I'm going to have a quick look at this here. And this is an article by Rabo and Huang. It's 2021. And the title of it is Witnesses and Victims Both, Healthcare Workers and Grief in the Time of COVID-19. And I suppose what they're writing about is the impact on you as healthcare staff of the COVID-19 experience and of the deaths and the difficulties. And what they talk about in this article is that healthcare workers recognise their responsibility to support the bereaved loved ones of our patients, but we must also attend to our own professional and personal grief in the COVID-19 pandemic. In the intensity and pervasiveness of COVID-19, healthcare workers' fears for themselves, and thanks again to the people who spoke earlier in the chat box about their own fears, their colleagues and their own loved ones are often in conflict with professional commitments. And I think the bit that's really important here, our healthcare systems have a primary responsibility both to prepare healthcare workers and to support them in their anticipatory and realised grief. Special attention must be paid to our healthcare worker trainees who may have not yet developed personal or professional grief management strategies and are coming into healthcare practice during a time of disruption to both teaching and clinical care. I suppose what they're saying there is the importance of mentoring, particularly mentoring around death and dying and coping with grief. So I'm going to show you again another short video, and again I will invite you after this to just pop in something into the chat box if you wish of your reaction to this. So this is grief in the nursing home.
Grief in the nursing home. There are two types of grief that are relevant for staff working in a nursing home. There is the personal grief of a staff member that arises from the loss of a loved one outside of the workplace. Then there is professional grief, which can arise as part of the employee's work in the nursing home. For example, when a resident in a nursing home dies. An employee may care for residents for a long time, sometimes years, and can develop strong bonds with them. They may spend more time with the resident than family members do. Healthcare staff in nursing homes can have a variety of reactions when a resident dies, which can include grief. Yet, family members are often seen as being the main grievers. And this is right, but the grief of staff can sometimes be minimised or discounted. A healthy workplace will recognise that employees need to be supported by their organisation around any grief, but particularly where the grief arises as part of working in a nursing home.
So again, I'll just give you a moment and invite you to pop in there. And I'm going to pop back here and just invite you, Aisling, maybe if we've any other comments that have come in there, just to check and we can catch up on those.
Yeah, absolutely. Thanks, Stephanie. So, now I just want to see where I saw. Okay, just kind of fear again there came up, and so the feeling of fear underpinned by the responsibility of residents and staff safety and how traumatic a COVID outbreak can be for all.
Mhm.
And death during that time affects staff emotionally, psychologically, and they may be the only person that resident had contact with before death. As staff, we should be allowed to grieve too and should be supported with the same.
Yeah, absolutely. That's so important. And there's a couple of things in there, Aisling. The trauma of an outbreak, and that has to be recognised. It must must have been and can be a very frightening experience for everybody involved. And again, as you're saying there, it does. What we know from research is that this does impact on staff, and it's not a question of an optional thing. Staff need to be supported around this, and it's a lot of the support that we need is the human response and allowing our grief and showing that is normal. Again, support, peer support is very important around this, and also a supportive approach from the organisation around the fact that staff can be quite impacted by this. The piece where, let's say, what you see in that video, where the grief of the staff member can be seen as less than the grief of the family member. I mean, I found it in my own case with my own mother. When my mother died, I became the primary griever. But those people who looked after my mum for a couple of years, they were quite affected by her death as well. And yet all of the attention went to me. We call that disenfranchised grief. It's where our grief isn't recognised as being as valid as somebody else's. And that's an important thing to be aware of. But the things that can really help around this are an awareness from managers that, look, it's important to allow our grief to facilitate it. Again, that idea of the loss coping and the restoration coping, and that's important to be able to do ourselves, and also for staff who may be experiencing grief in different ways, and recognising that staff can be impacted by the death of a resident. Thanks, Aisling. I don't know if there was another comment I think coming in there.
There's a couple of more comments, and I suppose just the pieces that this video is really resonating with people. I think that's really come across, and just maybe the minimisation of staff grief, and you've really covered that there, Bethany, and just another kind of different different comment was just around the feelings of guilt, and in particular around COVID coming into the nursing home, and how do we protect our residents and staff. Any advice regarding dealing with guilt? Now, I know this might not necessarily be in your piece, Bethany, but Sarah might be able to cover this in her piece.
Yeah, and we might come back to that at a later point. But just to say, guilt is a normal part of grieving, believe it or not. And we have to be very supportive and very careful that people in nursing homes don't carry that guilt around COVID. Around coming into the nursing home, or that we were dealing with a pandemic, but where people are experiencing that, it's really important to have open communication and support within the nursing home around that. And you might need some help and support with that. Sarah might speak a bit to that. I know there are other options that I can chat to you, Aisling, about, and we can follow up with that afterwards.
Perfect.
Okay, right. We've done that one. So what can help when you're grieving? What is the role of the manager? What can you do to help a staff member when they're grieving, or indeed when you're dealing with some of the things that we're talking about there with the outbreaks and that? And I suppose what we have to remember here is, would be Roisin's point at the start. You have to remember that you as a manager need to be supported as well. It's not that the managers have to do everything. You also need to be supported, because you're feeling a lot of these things as well. So we have to remember that and keep that in mind. Good supportive networks and asking for support yourself is really important. What helps when you're grieving? Some of the things that we know help in the workplace are, one, allowing yourself to grieve, the kind of theme that is running through today, and that's honouring your own grief as a manager, the grief of staff, and giving permission to people to grieve. Expressing your grief in your own way. We've talked about the instrumental and the intuitive styles of grieving. Caring for yourself is really important. Simple things: getting enough rest, getting good food, Also having support, really, really important. Getting exercise. I know they're simple things, but they really make a difference. And making a priority out of care for yourself. I'll say a bit more about that in the self-care piece. Looking out for colleagues. And this is, I think, something that's especially important. We need to check in and we need to reach out to colleagues around what has happened, particularly if there have been deaths in the nursing home. If people have been maybe the last person to be with somebody as they died, just checking in. How are you doing with that? That is a difficult experience. How are you with that? And amazingly, our colleagues, because they know the work environment and they know the demands and the pressures, they're uniquely placed to be able to offer support. So that's another thing that we know from research helps, that collegial support. And just keeping an eye out, maybe checking in with somebody, and also ourselves seeking support if we're finding things difficult and avoiding isolation. We set up a helpline with the HSC, Bereavement Support Helpline during COVID. One of the things that we were really blown away by, the people that came onto the line, was the fact of not so much that people were saying the wrong things to them or things like that. What people found most difficult who were bereaved was that people avoided them, believe it or not. So what I would encourage you is, as colleagues, if you've had deaths in the nursing home, just open up conversations with each other around it, and just check, like, how are you? That was difficult. How are you with that? That's important to check in. Some people might be finding it more difficult than others, but being able to share that with our colleagues can really make a difference. We have a...
Sorry, I might
Sure.
just come in there because I think it's timely. Someone just asked, and you've kind of covered it there, just something really practical. What supportive words can be used by managers to help staff coping in a professional grief with their professional grief? So just, yes, I suppose some practical pieces there.
Absolutely. What I would say is, don't get too hung up on finding the perfect words. Trust yourself, trust your humanity, and trust your gut. So if a staff member is grieving, just go in and ask them, how are you doing? I'm conscious we've had a number of deaths here. How are you doing? How can I support you best? What would be helpful? Open the conversation with the person. Don't get too hung up on the words. Sometimes there might be perfect words and it might feel a bit awkward. Don't beat yourself up over that either. But make the connection, open the conversation. So you can always say, look, I'm no expert to this, but I want to check in with you and see how you are. How has it been? You can use the facts as well. So if we had 3 deaths here in the last month, say, or we had 3 deaths during COVID, how are you around that? Are you doing okay? How can I support you best around that? Those kind of things would be really good. And the 3 steps I'm going to go through here, we call it bereavement first aid for the workplace. 3 steps: AVS, acknowledge what has happened. So acknowledge the losses, validate the person's feelings. So again, we saw some of the feelings in the first video of what's normal in terms of, it can be anger. I spoke about my jealousy when I met that lady. They're the emotions that can sometimes be a bit difficult to touch, but it's validating that is normal given what has happened. And S is for support and signpost. So support them as a manager, and signpost if you need to. If somebody is in distress, if they need more help, look to your employee assistants. I think Sarah's going to speak a little bit about some of the supports as well in the HSE. But what I would say is, don't rush too quickly over there. I would say use the support that you have. What people really want from you is a human response. And so go with that, go with your gut. And it's okay to say as well, I've been quite affected by these deaths. And I know in one of the earlier sessions we did together with the COVID response team, it was very obvious that everybody had really difficult experiences. And it was actually in sharing the reality of that people feel supported. So your role is not so much to have all the right answers, it's to be able to say, I've also been affected by this, and I want to know how I can support you. We're going to have a look at, I'm just going to back up there, sorry. In terms of validation, you did ask for some phrases there, Aisling. So some of the things that would be good in terms of validation, There's a couple of different things here. It's normal to feel that way. It's going to take time to adjust. It's very understandable that you would feel that way given what has happened. Or this one here, which I really like, I understand this is a difficult time for you. If it's a shared death in the nursing home, if it's a number of deaths that you've had, you can always say, this has been a difficult time for all of us. I know it has been difficult for you. How are you doing? What I would say is don't get too hung up on getting perfect words. Trust yourself. Reach out to the person. That's the most important bit. Open the conversation. Be yourself. Be compassionate. Be supportive. I'm going to show you a last little video now, and this one is on the manager and the role of the manager. So again, have a look at this and see what stands out for you.
Grief as a manager. As a manager, you have a key role in helping employees who are bereaved. Employees can be impacted by either personal or professional grief, or both. Personal grief is grief that an employee experiences from losses that occur outside of work. For example, the death of a family member. Professional grief is grief that an employee experiences because of losses that occur as part of their work. For example, when a resident, patient, or service user dies. As a manager, you have a key role in helping the employee to cope with their grief, as does the organisation if the grief has arisen as part of their work. Your organisation should have a bereavement policy. It is important for you to be familiar with this and know what entitlements or supports are available to the employee who is bereaved. In responding to an employee around either personal or professional grief, a helpful approach is what we call bereavement first aid. It's very important to acknowledge what has happened and to offer your sympathies. This is particularly valuable when done sensitively by you as a manager. Try to think of what you would say if it was a friend whose loved one had died. If you cannot speak to the employee in person, write a note or send a text or email. It's important for managers to take the initiative to reach out to employees who are bereaved. When someone close dies, a range of emotions can be experienced, including sadness, anger, disbelief, numbness, or despair. As a manager, it's important to validate these emotions as a normal part of grieving. Try to facilitate an environment where these feelings can be openly expressed. Returning to work after a significant bereavement can be very difficult for an employee. They may be worried about how people will react to them, or that they might get upset. You, as their manager, can put them at ease and assure them of being supported. Let them know the organisation is also supporting them at this difficult time and what it has in place to do so. As well as emotional support, you are in a unique position to offer practical support. For example, reassigning workload or authorising leave requests. Being a single point of contact between the person who is bereaved and their colleagues can be very helpful. This allows you to communicate what the grieving person would like others to know. It is vital to use discretion and compassion when supporting people who are bereaved, especially when applying any appropriate policies. Think about your bereaved staff member and what they need from you. You may feel awkward or uncomfortable around grief. That is normal, most people do. But try to overcome these feelings and facilitate the grieving process, because you can make a real difference to employees who experience grief.
Right, so again, just as we're coming towards the end, I'd invite you, if there's any comments you have or anything that struck you there in that video, to pop them into the chat box, and Aisling will go through them in a couple of moments.
Grief.
Oops, we've done that. So the last piece that I wanted to do was around self-care, and this is so important for you as a manager, or if you're supporting somebody who is bereaved at work, or indeed if you're grieving yourself. It's really important. And I suppose it's acknowledging that grieving is hard. We've got ABC here. The B is balance in your life, so that balance of processing your grief and doing your job. And I suppose this is very relevant for all of you involved in nursing homes, and indeed with kind of worries about a new wave and stuff like that. It's important to give time to your grief, and also to balance that with doing your job. It's not one or the other. It's being able to do both and move in and out of both. It's really important to have fun
I think you've kind of covered most of them that have come in there, Bethany, and just Sarah might, in her presentation, I think she'll cover off the rest of them. Okay. So yeah, everything.
Great.
Thanks very much.
Okay. Thank you very much, everyone.
Thank you so much, Bethany. I've heard some of those pieces before, but it doesn't become any less powerful, and I could just sit back and listen to you all day and just